We get this question all the time. Can a knee meniscal tear heal on its own? And we're going to be talking more about why there's so many misconceptions in the healthcare system on what to do. We do way too many knee surgeries for cleanups and meniscal tears that don't have to happen. And this will hopefully help you get a better understanding of how you can avoid having surgery and what are some of the possible causes that could be coming from as reasons why you're having knee pain. So let's take a little bit a look into the knee. So we have these structures on the outside. These are our ligaments on the outside. And then we have like our ACLs in the front and our PCLs in the back. So when people have a lot of times sporting accidents, ski accidents, they plant, they cut, they turn, they can have ACL tears, and those do need surgeries. But we have this structure through here. This is called a meniscus. It's kind of like the cushion in our knee. And that's what we're going to focus on for this talk, and just kind of give you some clarity as to why there's so many surgeries and how you can really avoid those surgeries. So if we look at the knee, and this picture doesn't really have it as well, but we also have structures, and I call them, they're the fat pads in the front of the knee. So you have these cushions, you know, when you straighten your knee, you'll see two little bulges on each side. Those are kind of the fat pads in the knee. And we're going to talk a little bit more about that, but because that creates some things that can really mimic a meniscal tear. And that is something that needs to be looked at, definitely from the eyes of a physical therapist that specializes in the knee, specifically that understands this, because that's where doctors get confused. Because you can have these fat pads that sometimes, you know, we might have twisted and turned, and they kind of get inside that joint, and it locks up that range of motion. And so a lot of times what you see with a meniscal tear, when you think it's a meniscal tear, is you sit for a while, the knee is bent, and then you try to stand, and that fat pad's kind of lodged in the knee a little bit, and all of a sudden you try to put weight on it and your knee wants to give away. Very similar to if you truly had a meniscal tear, that's some very similar things that can happen. You have a hard time, you know, bending the knee or straightening the knee, which is also very common with the meniscal tear, but that is also very common when we have those fat pads that are the problem. And so you can see how it can be very confusing when you just get this quick evaluation. It looks like a meniscal tear. It seems like it's a meniscal tear, but it may not be a meniscal tear. And that's where you really need to get a thorough evaluation from someone that's going to be able to spend time with you to make sure that that's what's going on. The other problem is imaging. So we have MRIs, and MRIs are not reliable. And the reason why I say that is because you go and you spend time with a doctor, and they spend like maybe, you know, 10 minutes with you doing a quick talk. Sometimes they don't even move you, but it's like 10 minutes. And then they're like, let's get an MRI. Let's see what's going on. So when you look at the research on imaging, if you take 100 people that have no pain whatsoever, you know, you're looking upwards of 60–80% of the people showing a meniscal tear, but they're fully functional, pain-free, no problems. So, and as we get older, what happens is that number increases. And so that's why there's that range. You know, when you're younger, you may not have as much. When you get older, you're going to start noticing a lot more meniscal tears. And so what they shows is the kind of the wear and tear. And how I describe this is it's kind of like if you have wrinkles on your face. It's just kind of what happens as we get older and as we age. And we need to, it's very similar with our joints. You know, the wrinkles on our face, on our joints could be, you know, degenerative changes, could be wear and tear. They could just be things that are there that aren't causing you any problems. So you can see if you come into the doctor and you have knee pain and they only go and image you and they say, oh, you have a meniscal tear, you have some arthritis, we need to go in and clean it up. And those surgeries, when you look at surgeries like that, are not great. So if they're coming in to kind of clean up your knee, they literally did research with a group of people that had knee pain. And they did a meniscal surgery, just a cleanup on one knee, and with a group of people. And then the other group of people, all they did was basically poke holes and did nothing. The group that they poked holes and did nothing actually did way better. than the people that didn't. So they thought that they got surgery and they automatically started feeling better. And so you just can't rely on imaging as being the main source. And really, you have to really let that fat pad that I was talking about in the front of the knees, you really have to get to someone that understands that, because it can mimic a meniscal tear. And so, especially as we get older, like if you're younger and you're playing sports, a lot of times that truly can happen. It happened to me. I played soccer. I knew when it happened. I was going after a tackle. My body, like my foot rotated. I had massive issues, positive tests, definitely had a bucket handle tear, had to take that off. But as we get older, what happens is that it's more of a wear and tear. Oh yeah, we need to clean that up. That's going to save you from having surgery. Okay, that didn't. So now we've got to go and start doing these injections. Okay, now now you need a total knee replacement. And a lot of times this can be solved early on. And so we're going to talk about some different things that we look at when trying to figure out what's going on with the knee. So what are some of the common sources? So the first one is the fat pad. That's what I talked about. It's in the front of the knee. It can give you that it can mimic a meniscal tear. And so literally we've just got to figure out whether we need to go into some flexion modes or some extension modes. But going through an evaluation process, we understand which direction we need to go by some questions that we need to ask you. And literally, honestly, in 3 visits, people are back to normal, if that's what's going on. And so that's like, I always tell people, come in, let's just make sure, because you're either going to get better fast, or that it really truly is a meniscal tear. If you're noticing things like my knee gives out, I can't plant, I can't cut, those kind of things. Other things you have to look at is your back pain. You may not have any back pain and it still could be creating some knee pain. And we have people that can't even, straighten their knee or bend the knee fully, and it still is coming from their back. I know it's crazy, but you have to rule these things out. And there's questions that we ask to kind of determine, are you noticing back stiffness, those kind of things. You may not even have back pain that could be creating some of your knee pain. So again, getting to someone that specializes in the whole body, not just looking at one body part. That's the other problem that happens in our healthcare system. Knee pain, I only look at the knee. You don't look at the whole body. It's all connected. And back pain is one that you have to look at. Hip pain is another one. You can have hip pain that's creating tightness that will create pain on the outside of the knee. You can have pain on the inside of the knee. This all can create issues. And so you have to look at that and rule that out. And sometimes it can be a combination of a few things. You can also have weakness, tightness around the knees and hips. And so these are all other things that need to be looked at when looking at common sources. So even when people come in and it's like they have more of an arthritic knee, well, is there pain really coming from that? Or is it just tightness and weakness that we need to address? Are the correct muscles working, in the correct way to support you, or is there some sort of compensation that happens? So these are all things that we need to look at when looking at knee pain and helping you avoid those surgeries and injections and those kind of things. So if you'd like to look at other resources we have, we continue looking at our YouTube channel. We have Empower Physical Therapy. You can search a lot of different things and resources there. We have a podcast called Empower Your Life. Go to our website, www.empower-pt.com, for lots of blogs, free ebooks. We have ebooks on knee pain. We have a lot of blogs on knee pain, different events that we're having each month on educational stuff. So definitely look at some of those resources to continue to educate yourself. And obviously, if you have any questions for us or anything, just reach out, call us, shoot us an email, and we can definitely help provide some more education, or you can come in and talk to one of our specialists for free to learn more on how we might be able to help you.